Right. Hi, welcome, Dr. Bennett. So I was wondering if you could first tell us your name and title and what procedures, research, or work that you work on.
Yeah, thank you, Christine, for having me. My name is Tracy Bennett. I'm an MD. My current title is Senior Vice President of Sales and Marketing for a company called Ceek Women's Health. And we really focus on gynecological care, specifically in medical devices. So we've been focused on it for the past almost 5 years, and we're getting ready to introduce our 3 products into the marketplace this year. They have been released during the pandemic, during COVID, but obviously with limited access, we're really excited to be able to introduce them to clinicians and providers in person.
Great, thanks. And so what's important to know about some of the conditions that you work with, especially with the 3 products you're developing for women's health?
Yeah, no, that's a great question. So if you think about just in the US alone, one of our main products is called the vaginal speculum, and that's used for pelvic exams and also gynecological procedures. And a lot of people don't understand how often that is used on a yearly basis. Just in the US alone, it's used approximately 60 million times for what we call a pelvic exam, or your GYN appointment, when you usually go and get either a pap smear, HPV exam, and then for the other 30 million times, it's usually used for a gynecological procedure, and that could be anything from a follow-up to an inconclusive or a negative pap result, to colposcopy, to hysteroscopy, and all kinds of gynecological procedures that involve, kind of the female reproductive organs, to keep it in a simple way. And the one thing that we're specifically very focused on as a medical device company is the patient experience. That's very important to us. And we kind of take a look at the current tools that are being used and how we can improve them for the clinicians, because that's also very important. We want to make sure that they can perform their exam or procedure more efficiently, more effectively, to help with the patient outcomes, but also to make sure the patient has a better experience during that exam or procedure, which a lot of them, as most females would understand, are uncomfortable, anxiety driven, just not something that people look forward to, but are of course very, very important when it comes to preventative healthcare for really a lot of the female reproductive organs.
Great. And so you mentioned the vaginal speculum. What was historically done, or what types of vaginal speculums have been historically used?
Yes, that is a great question. So believe it or not, a lot of people don't know this, but the current metal speculum that is being used to date was actually invented well over 150 years ago. And very little, really zero improvement has been made to it. It was made at a time when it was probably the best choice to use something to evaluate the internal vagina, and also obviously lead into the cervix. And but it is uncomfortable to the patient in so many different ways. Number one, it's metal, it's cold. There are some workarounds where you can warm them in a warming drawer, or you can heat them up a little bit, but then sometimes they become too warm because metal kind of retains that. Even at room temperature, metal feels cold. So sometimes when you heat it up and it's a little too warm, it feels warm. So neither one are very good experiences for the patient. The size is very important. A lot of times the size was just considered, well, I need to get into the vagina to open it up to view the cervix. So as long as I can, separate the vaginal sidewalls to see, the bigger, a lot of times it was the bigger the better, because I can really see more if it's a bigger speculum. But of course, what does that translate to the patient is very uncomfortable, right? It's very uncomfortable for the patient. The coldness, the clinical feel to it is just not something that a patient really likes to experience. And if you add to that, whether a patient has a history of rape or trauma, or whether they have certain physiological conditions, for example, cancer patients, cancer survivors, all the way up to, kind of the perimenopausal phase, a lot of that experience can be uncomfortable just due to the anatomy and the physiology alone. So we really wanted to try to take something that has been unchanged for over a century. And just historically, a lot of, even when you look at the pharmaceutical industry, a lot of the clinical testing was always done on men. And really, women were not considered a subject for clinical testing or products really that they took a look at to see, okay, what can we make better about this product? So we really wanted to make sure that we took these basic tools that are used in most gynecological exams and procedures, again, 90 million times a year in the US alone. What can we do to make them better for the provider, but also a better experience for the patient?
So you mentioned the metal speculum. Why not just a plastic speculum? What's wrong with the current plastic speculums?
So great question. So that was probably the one area back in the late 1960s that they took the metal one, they made a disposable plastic one. And that is a better improvement, but there's some issues when it comes to the current plastic speculum on the market. Number one, they're made usually from a plastic that is a styrene or a acrylic. And the styrene in particular, plastic speculum will tend to have, just due to the manufacturing process, they'll have kind of like little ridges on them, which makes it uncomfortable for the patient. They also are prone to breakage. And when I mean breakage is when it's transported, from point A to point B, the clinician will use it. And sometimes on physical inspection, it looks completely fine. But the minute there's usually what's called a microfracture inside of it, the minute they open it up, it sometimes break during use. And that is the worst thing you want for a patient, of course. You never want to harm a patient. But the current plastic speculum also make a lot of noise. When you open them up, you hear this ratchety sound. And as you can imagine, as a patient, most of the time you're lying flat on your back with your feet in the stirrups. And you're not sure really what's going on sometimes. And you hear that noise, that click, click, click noise. And all they're doing is opening the speculum up to see, but you're not sure. So what you naturally do is you tense up, you tense your muscles. And of course, that just makes the exam more difficult for the provider too, because now you're tense, your muscles aren't relaxed. So between, I would say, the metal kind of cold feeling, and also the metal noise, in between the plastic and the noise the plastic one makes when it opens, not to mention the environmental impact too of the disposable. That's another thing where there's some concern there. You really have kind of a not great experience for both clinicians and providers. And I've met with so many clinicians who have developed their own workaround to these products, which you really shouldn't have to. You should have a product that meets your needs, but also meets your patient's needs. And when you think about some clinicians that can use this 30 plus times a day, think about like a carpenter that uses a hammer and a nail. They use that product all day long. A OBGYN uses a vaginal speculum all day long. So you want to make it as comfortable for them, ergonomic for them, but also a better or more comfortable experience for the patient.
Great. And so that leads me to my next question is, what are you and Ceek doing to help solve these problems?
Yeah, no, that's a great question too. And the one thing we spent about 3+ years really fine tuning our requirements for making a better vaginal speculum. We wanted to make sure that we took a look at everything from the material selection to the ergonomics of the speculum. Granted, 150 years ago, I don't think ergonomics was even a term, but there are a lot of clinicians who get what's either called repetitive stress injury or even like almost like a carpal tunnel syndrome from using the metal speculum a lot, just because of the pressure they have to place, between their thumb and the thumb joint and the metal speculum. So we took a look at materials that were, of course, medical grade, but were also very strong and durable. And then we looked at the design. How can we make the design better so that it's, more ergonomical for the clinician, but also it's very important for them to see, right? They need to get in there. They need to see the vaginal wall. They need to see the cervix. And really, the whole goal is to get access to the cervix, whether you're doing just, you're taking a collection of cells or you're actually going into the cervix to do a type of procedure. Very important to get clear access to the cervix. The one thing that we found that was really lacking too when designing the speculum is the light source. A lot of times with the metal speculum, they rely on what's called a gooseneck lamp. And it's basically a light that kind of shines over your shoulder. And it's almost like you're shining a flashlight. It's a medical grade light, but you're shining essentially a light source into the vagina and you're trying to view the cervix. Well, a lot of times those are attached to the table or the bed. And what people don't consider is, you have a lot of touch points there. You have the patient that can touch it, you have the nurse that can touch it, the MA that can touch it, the provider that can touch it. So anytime it gets touched, number one, it's a potential area of cross contamination, but also it moves the light. So as you're doing an exam and somebody hits the light, guess what? The light source is going to move. So now you got to reposition it. And there are some other light sources that worked with the plastic speculum that we talked about earlier too. And again, the light source is driven from the bottom of the speculum. So what that does is it has usually a light pipe that carries the light source in the lower bill of the speculum, which is great. However, if you're doing a procedure or an exam where there's any fluid or any blood, just due to gravity, you're going to have that fluid or blood collect on the lower bill, right? And what's that going to do? That's going to block your light source because it's trying to come up through the bottom of the bill. So that was one of our initial ideas, was to make a light source, number one, that works on any speculum. So the metal, the plastic, or our new speculum clips on the upper bill. And that way it's not going to get blocked by any blood or fluid. And you can also move it. You can rotate it along the upper bill side to side. So if you do have to get tooling in on one side or the other, there's plenty of room. But going back to the development of the speculum, so the material, we really looked at a lot of materials and we selected a medical grade polymer that was what we call temperature neutral. So at room temperature, the patient will not feel that cold or that warm sensation. It'll be temperature neutral. So that also means for the provider, they don't have to warm it. They don't have to run it under warm water. It's actually a very strong material. So it's twice as strong as metal, and it's also twice as strong as the plastic speculum. So you don't have to worry about any breakage or any issues with the strength of it. And then you have all these things. So you pick a material and you test it. It has to be very durable. So we tested it to, usually the metal speculum goes through an autoclave sterilization process. We tested it to over 1,000 cycles of the autoclave just to make sure that it would withstand that traditional kind of cleaning and sterilization approach that most metal speculum are used to, and it does. So we picked a material that is both a medical grade, that will withstand the cleaning process, but also is more comfortable for the patient and the provider. And then when we look at the design of it, you want to look at things like, the aesthetics of it obviously is important, but also the functionality. So we wanted to make sure that it was as small as possible, but it was very important for us to make sure that the provider could actually see the cervix and view the cervix. And that's a little challenging when you're talking about just a traditional upper and lower bill, because you're basically taking an approach of opening up something this way, just upper and lower. And that's why usually the wider speculums worked a little better, because they were kind of keeping everything back. And the vaginal canal is, what we call a potential space, right? It's not open. It requires something to be inserted to open it. So the way we approached it, and of course, this was going through hundreds of prototypes. Is it not like, wish we got this in one shot, but we did hundreds and hundreds of prototypes, multiple testing on different types of patients with different types of providers, male providers, female providers, different skill sets, even down to, females with very small hands and males with very large hands. We want to make sure that it was comfortable to use and easy to use for everybody. So the one thing that we discovered pretty quickly is by introducing a lateral sidewall into the traditional speculum. So essentially, you have what I would call a gentle four-way opening versus just an upper and lower bill opening. And what that allowed us to do was to make the width of the Nella new spec about as narrow as a regular sized tampon. So what we say to clinicians, if your patient can tolerate a regular sized tampon being inserted, they can tolerate this product. And then what the nice thing about the mechanics of the design is when you open it up, the lateral sidewalls automatically open up at the same time. So again, it goes back to that gentle four-way opening versus just an upper and lower bill. And we really want to make sure, again, it was narrow and small, but it had that lateral sidewall support that ensured that the clinician could see and access the cervix.
Great. And then, so what further improvements do you think will be made? Like, where do you see the future of vaginal speculums going?
That's a great question. And we always say that the minute you release a product into the market, you get instant feedback on what you can do to make it better. So I definitely envision doing revisions to the current product to make it better, more comfortable for the patient, more user friendly for the provider. But also, we released one product as one size fits most. We recognize it's not a one size fits all. It's hard to do that with one product. So we recognize that over time, we're going to get some really great feedback on different sizes, different styles. For example, when you're doing a procedure where there's an electrocautery device, you need something that's called a smoke evacuator to evacuate the smoke from your vision. And so there's definitely some different styles, types, and sizes that we recognize we need to add to our portfolio. And that's just for the vaginal speculum alone. We also recognize there's areas where they might not have access to an autoclave machine, for example. So, it would be nice also to have a disposable version of it for those areas where they don't have a way to clean and reprocess it. And even for the light source too, the light source is something where, we made it as simple and small and compact as possible. To clip on the upper bill of most speculum, but I'm sure there's areas that we can improve on that as well, where over time we'll get feedback to really fine tune and make improvements in the next generation of the products.
Great. And just my last question would
Yeah.
be, what advice do you have for future medical students, medical engineers, people who want to work in this space, especially if they're interested in entrepreneurism and doing something as great as a breakthrough device for something that hasn't been fixed for over 150 years?
Yeah, no, and that's a great question. And the one thing I always talk about is our founder and CEO. The reason she founded this company was she was in what I call a very advanced area of kind of healthcare, so far advanced. And she struggled with infertility for many, many years and went to some very nice infertility clinics. And the one thing she was just shocked when she saw the metal vaginal speculum for the first time, she just was shocked that such an archaic looking device was still being used. And she did some research on it. And she did have, after successful rounds of IVF, she ended up having two beautiful daughters. And that was kind of her light bulb moment where she thought, I want to make it different for my daughters. And I want to make them have a better experience when it comes to pelvic exams or any type of gynecological procedure, because she had such a bad experience with just something that's been used forever and been around forever. You can understand why there was such a disparity between that and what's going on with other areas of medicine that are much further advanced and much further along. So that was kind of her, that was really the reason she started Ceek, is to make sure that, the females had access to devices that were really designed for them by people that are a lot like them. So we would say, we brought a women's perspective to the table, where traditionally most engineers were males. And it's not that they didn't have a great perspective, they just didn't understand it as much as we did. And I think now there's an opportunity for both men and female engineers to understand how to take something and make it a better tool for both the provider and the patient. And that's really what our goal was. So our CEO and founder, Fatih, really was driven on a better patient experience. And I always like to say, I have a 22-year-old daughter who's a senior at college now. And when she went for her first exam last year, I sent her with her own Nella Newsback. And my goal is to have her in her lifetime never have to use a metal or plastic one. She can just use the Nella Newsback. So our goal is it's very important for us to make sure that everyone has access to these products, and we're willing to work with a lot of facilities, because I know that sometimes there's different socioeconomic statuses, whether you have insurance or you don't have insurance. There's discrepancies there, and we want to make sure that that is addressed, that there's no patient that should not go without a better tool or device to give them better healthcare that they truly deserve. And that's really what our end game is, to make sure that everyone has access to our products and has the opportunity to have equal healthcare, so they have they have the ability to make their choice and be proactive in their own healthcare, and hopefully live long and healthy lives. And this is just kind of one area we're targeted right now, but it's focused on women's health.
Great, thank you so much. Do you have any follow-up comments or?
No, I would say probably the most important thing is to observe a lot, observe what's currently being done, and you'll be surprised at what I call workarounds for tools that are just ineffective being used today. So when I say a workaround, I mean something that you shouldn't have to do to a product, but you do it anyway to make it better for either you or the patient. And I think that's really something that once you get out there and start observing, whether it's exams or procedures, and it could be in other areas of healthcare too, you realize how there's so many opportunities to make products and devices better for everybody, and just really observing what somebody does on a daily basis, multiple times a day, and watch where their pain points are, or watch what the patient's pain points are, really will give you that insight that, and you can start to think about ways where you can make a difference or make it better, and really bringing something to the table that hasn't been thought about before. So, yeah,
All right. Well, thank you so much.
absolutely, Christine, my pleasure.